Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and today we're here to talk about the top 5 things every health plan needs in their toolkit for compliance this year. Step 1, starting with your regulators. Far too often, health plans, when they're approaching filing season, or any compliance function for that matter, always associates our administrative work with all the required templates, tools, instructions, and all the things off the side of your desk. Far too often, health plans forget about advocacy and what it means to actually touch with your regulator and build that relationship on the front end, pre-submission, before you actually file any documents, as you're planning your strategy for your product, during your submission, as the regulators are actually reviewing their filings, producing questions, objections, and then eventually dispositions, all the way up to certification. Health plans shouldn't just be dumping and running their filings and waiting for regulators to simply respond, but to proactively help them better understand your product portfolio strategy to alleviate and streamline the review process. If you're an existing carrier that's participated in a market for many years, year over year, you may already have these relationships, but you should also be mindful of regulators who are turning over. Folks who have been in the role for multiple years may be up for retirement. We saw plan year 2026 going into 27, a lot of churn from the reviewer standpoint, where now they're hiring a lot for plan year reviews next year. Maintaining relationships with your regulators and reviewers throughout each month of the year is critically important. For example, this plan year, we saw countless health plans raise rates across the board to the tune of 5%, 8%, even double digits, up to 13 to 20+% in the marketplace. So as an example, if you know that your issuer is going to have rate increases for plan year 2027 or plan year 2028, proactively reach out to your regulators and inform them, give them a heads up, help them better understand what they're going to expect when the filing is received. That could eliminate a need for a health plan to attend a consent order or to attend a rate hearing where they have to show up in person, or by way of a virtual event to defend their position about their rate hike or rate increase. So ultimately speaking, being proactive and advocating for your plan partners not only will just better your relationship with your regulators, but it will save time during the review process, giving you speed to market for approval. It will also ultimately mitigate any risk with that state, or most of that risk with that state, for any risk to fines, getting a fine by a state for noncompliance, or even down to the degree of disbarred from participating within a marketplace, on the exchange, off the exchange, or other. Really having that relationship is going to be key, and it can be done on 2 different levels, both on a tactical level for your teams that are actually completing, compiling, and doing the work and submitting it to the reviewing analysts. Aside from a tactical level, your executive leadership team can also be an advocate to commissioners of each state by attending national NAIC conferences. We encourage folks to make the investment to actually show up in person, even if it's before your plan submission or during your plan review and certification. It's a great investment of your team's time, both on a tactical level to integrate with your analyst reviewers, as well as your ELT members on a leadership level to integrate with your commissioners. Second tier regulators, if you don't have the capabilities or staff internally to support core dedicated resources, we recommend you work directly with your health plan association to help advocate on behalf of your plan. While large payers can still work with their plan associations, we've seen a lot more value come in with more regional players or startup health plans to really lobby together and to have a unified voice across your geography in the state that you participate in. Generally, health plan associations can carry more weight and strength within decision-making power and forming a position across an entire state, red or blue. And the fact that we know that there's roughly 14 state-based exchanges across the country, we know that there is ample opportunity for plans to participate within monthly association meetings, or if you don't have a membership today, we encourage you to invest in one for tomorrow. Now more than ever, we encourage all of our payer partners to get involved or strengthen their partnership with their health plan associations. For one large and recent example, the Big Beautiful Bill, coming into force for the rest of this calendar year into plan year 2026 and plan year 2027, health plan associations have their eyes all over this. And it's important for the associations themselves to understand the disproportionate impact across all the carriers participating within their state based on the carrier size, based on the carrier membership, or based on the carrier intent of operations. So we do understand that each issuer and carrier enters a market with their own strategy, their own product strategy, their own plan strategy of what they're going to offer to serve their members. We want to encourage healthy competition across issuers through plan years to come while we manage these regulations, but also want to make sure that each carrier is communicating with one another and forming a unified voice with their health plan associations to ensure proper advocacy while the big beautiful bill is unfolding. At this point in time is harnessing a window of opportunity where issuers can make changes or make strategy changes that could influence how states develop policies and how states develop net new mandates next year and the following year that will ultimately be wrapped around the big beautiful bill. Because we do know that the federal government can continue to deploy federal legislation while states are producing state legislation that ultimately may supersede that. While that being said, having that voice within this window, within this calendar year, is also critically important to being heard. Making sure that you're working with your health plan associations, having that unified voice doesn't exclude you from competing against other issuers and competing for that membership that you're going to serve, but ultimately to streamline policy operations within your business. And resource number 3, technology that connects the dots. We are seeing across the board health plans, whether you use homegrown systems internally or sticky notes across the side of your desk, OneNote, Microsoft Word, or Excel, everybody gets the work done somehow. But looking into the future and harnessing these complex requirements, whether it's on a state level or a federal level, we know that they're not going away and states will only be strengthening these rules and requirements over time. So taking a pulse on your current product organization in your ACA department, look at your team. Are you using any tools today? Talk to your Medicare Advantage partners, your neighboring product folks, to understand, do they have any homegrown tools that they're using, maybe that they purchased or built with a separate budget to your product. Health plans in 2026 going into 2027 are bringing their health technology up onto the enterprise level. So making sure health technology is consistent across the board, serving all members within an organization's footprint. For the past 10 years since the inception of the ACA product strategy generally has been made in a box. In the last 5 years, we've collaborated with other product partners within commercial organizations, but really in 2026 and 2027, we need to have synergistic cross-product strategies, including health technology. We are seeing issuers and payers historically have used and harnessed technology or health technology for manipulation of data and analytics, building reports, building SQL, and delivering data from point A to point B. What has gone forgotten over the past 10 years of the ACA, and any product development for that matter in the healthcare industry, is codified technology to manage workflow and project management. So while we recognize that workflow and project management technology has gone unnoticed, shameless plug here, ClearFile has done a phenomenal job for our health plan and payer clients in harnessing the complexities of not just ACA requirements on a state and federal level, but cross-product consistency across Medicare Advantage, ICHRA, even down on the low levels of products, how to package filing requirements, when they're due, and how they're reviewed, all the way to submission and approval. We understand different payers and health plans at different cycles have different needs at a point in time, and we know there's a common theme of budget constraints on a health plan level as well. So having a good understanding of where your business is investing their money and their time for your product development will be very important to understand how you'll apply that to health technology. What does it mean for you? What does it mean for your department and your business? Your team on a tactical level doing the work may have different needs than the executive team of the people making strategic decisions. So understanding there's different needs at different times, find a middle ground, talk to your product teams, understand their strategy, understand the impact to all these new state and federal policies, and harness health technology for the future. It's really going to become a theme over time. Getting ahead of it will only save you time in the future. And number 4, internal reporting and operational readiness. It's easy to forget the level of reporting that occurs throughout the life cycle of an ACA submission when you're packaging a filing at the beginning of the year and you spend 8 months working with regulators to approval. What happens post-submission is filers are always posed with starting a net new plan year for creating a net new plan year package, while also attempting to evaluate metrics and analytics from their membership in the previous enrollment. So at this point, we know most states require intermittent reporting throughout each year, whether it's filing PCP turnover reports to understand which NPIs or which providers and which facilities are no longer with my network or not, or even PCP wait time reports. With reporting comes analytics. So generally speaking, our health plan payers are pulling and manipulating data from their data warehouse. whether it's a facets, whether it's a homegrown system, really having a good understanding of the reports your state is seeking and building in that criteria and configuration, whether it's SQL, whether it's Power BI or other, will be critically important. The last thing you want to do is enter a new market or expand your footprint where reporting is required and you don't have the analytics or the functions in your organization to sustain that work. One common example is network reporting. We know some issuers who offer both the ACA product and Medicare Advantage may leverage the same or similar network adequacy to serve the members in those two separate populations. Now, where the complexity comes in is the ACA network may be managed by a different database, separate than the Medicare Advantage network. So ensuring if you don't have cross-product consistency for your reporting and analytics, maybe there's an opportunity to talk to your leadership team and find synergies across your network reporting and your network systems. We do know change is hard. Change can cause rework, but ultimately speaking, harmonizing your products and harmonizing your technology across your book of business will only give your members a better experience when they're enrolling into your plans. Another common point of abrasion that carriers have been put up against in reporting to states is transparency and coverage. So understanding the claims and analytics that are produced both for your ACA product, your Medicare Advantage product, or any product in your business that produces claims could come from different systems, different formats, all different shapes and sizes. While we recognize whether it's through states' RFRs, their general instructions or guidance, they don't always often specify formats for reporting and how they'd like carriers to submit them. We encourage carriers to standardize their own reporting and their own formats because we know that it'll streamline the review from a state perspective. We recognize these may seem like very large-scale initiatives to harmonize your products across your organization, but it's definitely worth investing the time to have the discussion. And even if it's not something that you can feasibly conduct this year, make a 1-year roadmap or a 2-year roadmap to deploy these policies and procedures or to deploy codified reporting requirements for your teams. And finally, tool number 5, external or vendor support. Full disclosure, we offer this kind of support at ClearFile, but right now what we're going to get into applies to really any vendor that you're looking to work with across the board. We really break up external support and external capabilities in 3 different ways, based on your standardized rate filings, form filings, and binder filings. From a rate filing perspective, we do see our payer partners partnering if they don't have a dedicated actuarial credentialed staff on hand, partnering with either management consulting firms or boutique regional actuarial firms across the country to externally source their rating and premium setting for their medical products. And from a form filing perspective, when we are drafting contracts, redlining EOCs, developing SBCs and SOPs, we see our payer partners look to more of a legally or compliance-focused arena, such as paralegals or law firms, to complete that work. When you approach your binder filings, the more tactically and technical filings using cost shares and copays that require very detailed federal and state-based system validations, that's where it gets a little bit hairy. If we look at how health plans are currently staffing their organizations to produce binder filings, form filings, and rate filings, historically they're in separate departments. We understand the dependencies of building a strategic product portfolio, handing it off to your actuarial partners to price that product portfolio, and then providing it to your form filers to draft your contracts for that portfolio, all driven by different product executives across different areas within your organization. At ClearFile, we look at all those filings as one unit. We track them in tandem with one another so that we're tracking dependencies and what we call have deployed change control governance. So understanding that when decisions are made, we are tracking all the versions across all the hundreds and not even hundreds, thousands of filings across these 3 major filing types across your issuer so that we understand why changes were made and when, who made those changes and why, what the root cause is, and if we need to analyze the business area, really drilling down to understand why decisions were made at the front end of the year that will impact member enrollment at the latter half of the year. All that comes together through the relationship between the rate filing, the form filing, and the binder filing. So tracking all those 3 workflows in unison has not only increased health plan speed to market, but the quality of their filing, reducing the number of errors, reducing the number of rework, reducing the ultimate body of rework for the regulators, and improving that relationship with the state and CMS. So when we talk to health plans and evaluate their needs, we understand based on the size of each payer or issuer, they could be looking for something different. So how you approach external support or a vendor should be based on a couple factors. Really have a good harness on your budget. What is the value to your company of having a service support function to your business? Do you currently have staff on hand that's completing the work today? If so, that's great. Are they providing you what you need to actually achieve the goals for the next step of your business? Maybe, maybe not. It's important to understand the mission and the vision of the supplier or the vendor. So far too often we work with suppliers that are expanding their scope far beyond their expertise. So really understanding the core functions of that business and the service that it'll provide to you. Finding a flexible vendor to meet your needs that is not just reacting to new policies and reacting to new mandates, but predicting them or what states could produce in the future, what CMS could come down with, by actually showing up and advocating for your plan. We recognize it's a big time investment to source, find, and interview your vendor supplier partners, but really encourage everybody to carve out the time and take a hard look and at least build your virtual bench of suppliers, if not for today, for next year or whenever you do plan to double down and capitalize on your product growth strategy. I know we covered a lot today. I hope you all found these tools helpful. Leave any questions you may have in the comments. Give us a like, give us a share. We'll see you all next time.